Dr. Primm. How are you? I'm so glad to have you here today. Your unapologetically Black unicorn self.
Thank you, Keris, for the invitation and the opportunity. I'm honored to join you in this.
Yeah, I always love the conversations that we've had over the years around the intersection of race and mental health, emotional well-being, especially for Black and Brown folks, and your commitment to ensuring folks have what they need at the community level, the individual level, to live, as healthy lives as they possibly can. So I call you Dr. Primm, but really I call you Annelle. So I hope it's okay if I call you Annelle.
Of course.
But people should know you're a psychiatrist.
Yes, I am a psychiatrist, and I am a community psychiatrist, which basically means that when I think about psychiatry and mental health, I'm not just thinking about the one-on-one of, sitting down with a person in a clinical setting and working with them, but I'm also thinking about populations and communities and what goes on in those communities that may or may not promote mental health.
And how was it that you decided to get into psychiatry? I don't ever think we've ever talked about like how you came into the field.
Well, from an early age, I was always interested in listening to people and, maybe their problems and concerns. And I, wanted to be a part of the solution and helping them, work out some of those issues. So I thought I would be a psychiatrist. My dad was a physician, and I know that influenced me as well. He took me on house calls with him when I was as young as 5 years old. Not to mention that I really loved the psychiatry textbooks that we were assigned in medical school. And, I took them to bed with me as pleasure reading. And I realized, just how fascinating the study of the brain and the mind is. And, I had a wonderful experience doing my psychiatry rotation in medical school at Walter Reed Hospital and working with largely at that time Vietnam veterans and learning about the trauma and experiences that they had. And so, I finally realized that this is me. It's a very good fit, and I must say I'm really glad that I chose psychiatry as a specialty because of just how many dimensions there are to it, and you can have such a varied experience, and I'm thankful for the varied experience that I've had from, doing clinical work and administrative work, teaching, public speaking and writing, a little bit of research, and also engaging with communities on, various projects that, relate to the mental health and well-being of communities.
Well, we're glad that you're in psychiatry too. Otherwise, I might not have met you. I think through maybe NAMI Urban LA in particular. And, it's not very often we get to see Black folks as psychiatrists. There are a number of them. There are a lot. But sometimes, you don't get to actually see folks who look like you in this profession. When I met you at NAMI Urban LA, they were rising up as a African-American centered affiliate of the National Alliance on Mental Illness and focusing on the mental health of their community. So how did you get involved with NAMI Urban LA and get to meet some of the folks there?
I got involved with NAMI Urban LA. I'm not going to remember the year, but it was in the 2000s. And I was working at the American Psychiatric Association at the time, serving as the director of what was then called the Office of Minority and National Affairs. And so, I was all about diversity in mental health and eliminating disparities and, working towards mental health equity. One of the projects that I had the opportunity to participate in on behalf of the American Psychiatric Association was a partnership with the National Alliance on Mental Illness Multicultural Action Center. And we decided to undertake a joint project to develop, mental health psychiatry primary care collaboration that focused on the mental health of diverse populations who are often very likely to be first seen and only seen in the primary care setting. We developed a curriculum that addressed those three dimensions, primary care, mental health, and people of color. And we were very conscious of engaging people with lived experience to educate folks in primary care. And, we delivered this curriculum initially in pilots to places like NAMI Urban LA. We partnered with NAMI Urban LA to identify leaders who would join us. We did it also in St. Louis and in New Orleans. So it was a wonderful experience. And I think that's where I first met you, because you were one of the folks affiliated with NAMI Urban LA, who came to one of these trainings. So anyway, that's how my connection with NAMI Urban LA began. And I was just delighted to see the kind of leadership that existed there and the many champions like yourself that were, gathered there and, doing all sorts of creative things to raise awareness about mental health in communities of color. And that was not happening in many places. Mm-hmm. At that time. It was not known as a diverse organization necessarily, but NAMI Urban LA was really, the first NAMI chapter that I was aware of that really put the issues of the mental health of people of color on the map. Mm-hmm. And, so I thank people like yourself and Bebe Moore Campbell.
Yeah, as you were talking, because I couldn't remember how we first met, that is exactly how and where we first met. I was so interested in the project because it was NAMI Urban LA, at the time, and maybe still does, went by NULA. And I was a member of another NAMI affiliate in the city that I lived in Pasadena. So I sort of was, a member of two NAMI affiliates, one that was, in the city that I lived in of Pasadena, and then NAMI Urban LA, where I could be around people who look like me, and kind of, it was a really, really powerful experience. And remember that curriculum. I think we called it In Living Color, two snaps up, not that In Living Color,
yes,
but the other In Living Color. And it was so meaningful.
That's right. Thank you.
Yeah, to be able to work on something that was specifically addressing the needs of our communities in primary care, where most of us might be going to get services either because of lack of access to mental health care or because of the stigma, not wanting to go directly to mental health care specifically, but having that opportunity for primary care to be aware of our needs around mental health and emotional wellness. So you brought up knowing Bebe Moore Campbell. I only met her once at a book reading, but she's another kind of powerhouse. And we have July, which is Bebe Moore Campbell Minority Mental Health Month. And we know there's now people are calling it BIPOC, and we don't like the term minority. Totally get that. For many communities, folks of color are no longer in the minority. But can you talk a little bit about Bebe Moore Campbell and her legacy?
Sure. Well, Bebe Moore Campbell was a prolific author and was really truly a mental health champion and super advocate. And I remember she was a part of a group of women who called themselves the NAMI Mommies, who helped to spearhead the establishment of NAMI Urban LA. And, I think one part of Bebe Moore Campbell's legacy is that she just really elevated, this conversation about the mental health of people of color and just the realities surrounding that. Because in other communities not of color, the issue of mental illness and people being discriminated against because of having a mental illness or a family member with a mental illness, that was kind of a baseline issue. But when you overlay being a person of color in this society and the quote unquote, double stigma that having a mental health issue and being a person of color, it's really a double whammy, so to speak, in terms of the discrimination associated with each aspect of, one's experience, one's lived experience, and, one's racial and ethnic identity. Something must be done to ensure that people of color with mental health needs, get the care that they need. Mm-hmm. Getting in the door, that's one barrier to surmount. But then the issue around what happens once you get in that room. Is the person on the other side, of the table or the desk or whatever, do they understand you? Do they have the cultural humility, to appreciate where you're coming from, to be able to evaluate you in an objective way and to give you, appropriate quality treatment, mm-hmm. Taking into account all aspects of your life, which may be very different from that person, providing the mental health services. And so, having that kind of advocacy coming from this, powerful, well-known individual, she just really put these issues on the map, and it became a springboard for really all of us to be vocal about these issues, to give presentations in national settings and, to really make this a big deal. And so when Bebe Moore Campbell undertook this campaign to actually, declare that a month would be designated for the observance and acknowledgement of mental health in communities of color was just a huge deal. And the fact that she did this as, she was very ill, mm-hmm. And that, her supporters rallied around her and pushed to actually get this month observance of July through Congress, got numerous congressional supporters on board to make this a reality. So, I'm so glad that, I'm living in a time when we look to her with such reverence and appreciation for, her tireless efforts to keep the issue of mental health of people of color in the forefront. I think you were talking earlier about people, changing the name last year. I think most of us really feel a strong need to continue saying her name, mm-hmm. and underscoring that this was through the efforts, the initiative, and the vision, of this very talented Black woman, who was so committed to this cause.
Okay, you just put on your unicorn horn. Thank you very much for that unapologetically Black unicorn moment. That is, it was so interesting to kind of see everybody calling it suddenly in this past year after the deaths the killings of so many folks, to, the new terminology is, BIPOC or Black Indigenous people and people of color. So suddenly Bebe Moore Campbell Minority Mental Health Month was BIPOC Mental Health Month. And it was like, wait, what just happened? Like, no, I mean, yes. And is kind of how I do my nose, like, yes. And we have to say her name. We have to remember kind of how we got to this point, not to at all, poo-poo on the fact that terminology changes as time changes. People try the best way to identify themselves in relation to others and or in response to things that are going on. That's great. However, this is named after a very powerful Black woman who advocated on behalf of Black folks and folks of color that we need to say her name, as you said, and carry it forth. So it could be, Bebe Moore Campbell BIPOC month. I have no idea, but Bebe Moore Campbell's name does need to be there so that we don't lose sight of that genesis. So Speaking of needs of Black folks, I got to meet Bebe I knew her through NAMI Urban LA a little bit, not a lot, but finally my parents got to meet her when she was doing a reading of one of her books, 72-Hour Hold, and they were out here in Los Angeles. So I asked them to come to this reading. And my mother's name is Bebe as well. So I thought it would be really poignant on many levels for my mom to meet another mom who has a adult child with a mental health condition, and also for her to see a Black mom kind of maybe going through some of the things that my own mom went through. And it was a powerful meeting. It was really, really kind of cool to see them, the two Bebes, kind of meeting together and having a moment. So it was really powerful.
Yes, yes.
And, when I think of families and people living with mental health conditions or not, especially over these past so many years, but, it's generational, but like, how do we keep up our emotional wellness, our emotional fortitude, I'll put it that way, when there are so many things that are impacting our ability to be and stay well, from just the police violence, the poverty, systematic issues. Like, what are some of the ways or that people can stay and be well when we're kind of surrounded by this day in and day out?
Yes, I mean, I think that this has been a critical issue, especially over the last year. And, I think it's been an issue all along for, Black people in this country, having to deal with, some of the structural inequities and the social determinants of health that, just affect all aspects of our life, but particularly affect our mental health. It has had a piling on, a layering effect that has been very traumatic, collectively to Black people in particular. And so how to deal with that, there are a number of ways. I think limiting media exposure and really avoiding the repetitive and ongoing viewing of some of these very violent and disturbing and egregious acts, making people feel devalued as Black people and negated as if Black lives don't matter, given just how frequently these things were occurring. And, all of us knowing that that could have been us or, somebody very close to us. And so that's one way, limit some of the repetitive exposures to, these violent, tragic episodes. Secondly, is being very conscious and deliberate about taking care of ourselves. And that may sound like a platitude in some ways, but it really is important for people to maintain their equilibrium in the face of the stressors that come along with living in this society right now. So we really do need to be conscious of, trying to get sufficient rest and staying hydrated and, trying to eat balanced meals and trying to get, some sunshine, for vitamin D and some physical activity, which is also good for our bodies and our minds. And, whatever sort of spiritual practice or meditation or yoga or, whatever brings people joy, because I think that we really underestimate the pleasurable activities, that each of us go to, whether that's, reading or knitting or dance, creating art, whatever that may be. I really encourage people to be very deliberate about engaging in those things that bring joy, because it really serves as a counterbalance to some of the negative things going on. And if you're deliberately seeking out the positive things that bring you joy, it really does offset, some of those negative sensory inputs that we are being bombarded with all the time. Mm-hmm. And I think staying connected to the people that you care about. This is one of the reasons why, in the midst of the pandemic, when even though we might have needed to be apart physically, that we really sought to find ways to stay connected socially.
Yes.
And fortunately, we have a lot of means by which to do that today, so that the social aspects and that we could maintain relationships. And fortunately, there have been some very innovative strategies that organizations like the Community Healing Network and the Association of Black Psychologists have created back in the early 2000s. Something called emotional emancipation circles were developed by those organizations, which created safe spaces for members of the Black community to come together to process the ways in which white supremacy has affected Black people, over the past 400 plus years, but to do so collectively, understanding the history and understanding how people have survived through that and the sorts of coping skills they have used, and just ways of liberating their minds to prevent the internalization of some of the negation of Black life and Black excellence.
This is, when you first, I think you had sent me an email about the emotional emancipation healing circles and the work that was being done. And when I read it, so I'm going to say it again, because I think that each word is so powerful, right? Emotional emancipation healing, emotional emancipation healing. Like, I have to say it over and over and over again, because it so resonates kind of with who we are as a people and what we've been through and what we need to be free of, and how to free ourselves of that by addressing some of the historical people that have said, well, slavery was 400 years ago, like, get over it. My father says, well, all of that's still in our DNA. And I thought, wow, like, what does that really mean? It's like, no, we collectively understand what that is as peers to one another, in working through our emotional health and wellness. Just so powerful, to know that these things are happening at the community level for particularly Black folk and people of color. I always think about how can we empower people? Or I always say people have the power. We can't empower them, but because they already have it. But how can we help people use that power to kind of move forward in these times? I think people are finally getting it. We have a new administration. What can people do now, do you think? What are some of the things that we could be doing now? Having these conversations, number one, I would say. What else could we be doing?
I think that we should be encouraging people, including young people, to look around their communities and to call out those things that they see that aren't right. Let's say communities where there aren't enough, they've been referred to as food deserts, and I don't know if that's the correct term now, but communities where there is not ready access, within proximity to, fresh foods and vegetables, and or communities where, every other corner there are liquor stores. And so, there are more liquor stores than there are places where people can get healthy food. And so, working on changing something that's clearly not in the community's best interest. And, sometimes those patterns that we see in certain Black communities that may be economically distressed, are a part of the elements that contribute to some of the disparities in longevity that you could see within certain neighborhoods of a city like Baltimore, where I live, compared to other parts that might be more affluent and racially homogeneous. And so, just being observant, noticing, what is not right, and then finding people who also are disturbed by those kinds of disparities or injustices, and begin to map out a strategy and identify more allies to change that thing, whether it's through, working with legislators or, just working on the community level. But I think the critical piece is that you have to organize. It's hard to do that kind of thing by yourself. But if you can bring people together or join an organization that's already focused on these issues and, join forces to make those kinds of changes, I think those kinds of efforts offer promise. And I encourage young people in particular to become a part of those things, because it should be a part of our succession planning.
Yes.
To have young people start very early, being aware of how best to collectively identify issues in communities that need to be changed, and, brainstorming and exchanging information and strategizing about, how those things, or what are the steps, and what are the, the portals and the levers,
yes,
by which these things can get done. And so I've, been fortunate to be a part of organizations like that seek to make change, for the better, that are driven by people in communities, by those people, for those people. And I feel like that's happening more and more, things like, community-based, participatory, or community-driven, community-led, these things I think are being acknowledged more, that it's critical to have to spawn that type of leadership and continue to support and grow that kind of leadership in communities to make changes that are necessary.
To grow our unapologetically Black unicorn out there. So I think that's actually, first of all, I think you've done a good job of doing that yourself. I certainly wouldn't be where I am today had I not met you, had you not either knowingly, or whether I bugged you about it, I have no idea, but I maybe it was a little bit of both, taken me under your wing and supported me and kind of said, oh, come here, or, oh, present with me, or, oh, do you want to be on this work group or this panel? It's such an example of how I've grown into being an unapologetically Black unicorn. I don't think I came out of the womb that way, but could be. But certainly I think, you have been such a good, wonderful mentor and teacher, friend, colleague to me, and also an example of how I can also bring up other people alongside. So, I want to give you that recognition and bow down before you, because I just want to say that this is one thing I remember. I think it was at a NAMI conference, and I had to, I think I told you that I had either gotten on the board or become the president of the board. I don't remember what. It was one of those two really pivotal things. I think it was being elected president, and I couldn't tell anybody, but I whispered it to you, and I was crying. And you were like, what are you crying about? Are you okay? Are you? And I was like, no, I'm crying because I don't think I could have gotten here had it not been for you and you supporting me. I mean, I don't have words for what this means, not just to me, but to the many people who you have supported in their careers, in their lives, just because you are an unapologetically Black unicorn. And I think you are thinking about succession planning, mentoring, and creating, the new up and coming leadership.
Well, thank you for all of that. It's been a two-way street, because I've learned so much from you and continue to learn. So it's really been a co-mentoring relationship. And, you too have, positioned me and really poured into me. And, you're my go-to person for so many things, as a confidant and advisor, on all issues, related to mental health advocacy and mental health policy. And so ours has been one of those relationships that has been, symbiotic and mutually beneficial. And another example, as the whole is greater than the sum of the parts, because there just been so many areas and organizations working collaboratively, you and I, along with others, that we've been able to make a mark. And so that is just so, joyous, to be able to be a part of a group of forward-thinking people that I think, we have certainly made a difference. And I'm, just so thankful to you for being, that kind of a partner and friend and comrade in this struggle.
Yes.
And the struggle continues.
Yes,
for sure.
It continues.
It's ongoing. Yes, but I feel encouraged by, what we have done and, challenged by what remains before us. And
we're going to move forward.
Absolutely. And just for amplifying with your podcast, amplifying this work and this topic, because I don't know that, these kinds of conversations are taking place very often at all, especially through this lens, and that you have created, this space that you've created.
Yeah, it's been really interesting. It's also been fun because, we have these conversations together on the phone or through text. And it's like, wait a second. And at the end of them, we're usually like, oh, I really wish somebody could have heard that. So I thought, well, maybe this is an opportunity to help people hear some of the things that folks are talking about, either in private or in smaller groups, and bring it to the larger, I don't want to say the larger world. I'm not that big, but you know what I'm saying. So I just think it's critically important for us to elevate the conversation so other folks can hear it. So thank you for being willing to do that with me. I really appreciate it.
Oh, thank you. My pleasure. I appreciate the opportunity.
Yeah, so there'll be more Unapologetically Black Unicorns every week, but this has been just a joy and a pleasure. So thank you, Dr. Primm, and more next week.
Thank you so much. All the best.